Welcome to Healthcare Today. The flat foot can be seen both in children and also in adults. The reason is different in both cases. In children, it is usually developmental, where the heel bone, it has an abnormal movement with its ankle joint, and the heel bone slips away and thus cause the fall of medial arch and creates flat foot. In the adult, the muscle which is the responsible for maintaining the foot arch, in the medical term we call this tibialis posterior, this muscle slowly get dysfunctioned, get diseased and finally torn out. When the muscle is not working, the arch falls down and the foot gets flat. In both the group of patients, the children and adult, they all need some kind of treatment, especially the adults who develops flat feet after their middle age, who are either normal in their childhood. If they start developing this kind of deformity in their foot arch, they definitely need treatment. Every person will need treatment. And for the children who are having flat arch, maybe all the children not need treatment, but some of the children definitely need some treatment. If you have flat foot, don't neglect it. Consult your foot and ankle specialist surgeon to know do you really need any treatment or not, because the neglected flat foot can cause a grievous medical consequence in your later life.